what I'm going to be talking about today is I'm going to draw on some of my previous experience with preclinical work, looking at how we make sure that we know, the levels of drugs that are required to elicit an appropriate response, how we go about taking that information and making sure that in patients we're actually achieving that. And we have an example of an EGFR inhibitor, lapatinib, where we studied that in vitro, and then we looked at patients and clinical trials with lapatinib to assess lapatinib concentration in brain tumors. And then, using, that type of information to make conclusions about the clinical response in those trials. In other words, is the level of drug and the level of target inactivation that we set out to do achieved in patients? And if not, the lack of a clinical response is likely due to that, rather than, for example, the biomarker was not predictive enough. So that's one major point that I want to make. The other major point that I want to make is that in the case of glioblastoma, there's always this, this idea that glioblastomas will never be responsive to a targeted agent because there is no such thing as oncogene addiction in glioblastoma. Now, I would argue that if you look for the literature, you will find a number of reports of exceptional responders in various clinical trials using targeted agents. Now, granted, these are N of ones for these responses, but if you look at at all of it together, you can say, well, this is the evidence that oncogene addiction can exist in GBM, and so the question shifts to: is it real? To are we do we know enough to identify the patients who will benefit from a specific treatment? And then the final point that I want to make is, we've already exhausted sequencing as the major source of identification of new targets. And the TCGA had done a lot of groundwork for GBM because it was the pilot project. So we can't really rely on sequencing information to identify new targets. And so we need to sort of change our targeted identification paradigms in order to come up with new targets. And so this is, I will discuss some of the approaches that we've taken to do this.